Okay, we are recording. So my name is Lexi Graham, and this is video number 2 in the gold standards for COPD exacerbation. This is for respiratory 2480, and in this video, we're going to be talking about supporting prevention of COPD. So some key points in regarding prevention and maintenance. The main treatment goals are to reduce symptoms and future risk of exacerbations. The management of stable COPD should be primarily based on the assessment of symptoms and the history of exacerbations. Some things to review to help prevent and maintain COPD would be obviously their symptoms, exacerbations, smoking status, exposures to other risk factors, inhaler technique, making sure they're doing using their inhaler right, what type of physical activity and exercise are they getting daily or during the week, the need for pulmonary rehab, how bad their dyspnea is. You can write them action plans if they need to review if they need oxygen, non-invasive, lung volume reduction or palliative approaches, if they have their vaccines, management of other comorbidities, and then spirometry. They should be doing that at least once a year to reevaluate and make sure they're staying on top of their disease process. So a few key points for prevention of COPD. We're going to be talking about smoking cessation, the vaccinations, and an active lifestyle along with pulmonary rehab. And these are just the key points in prevention for COPD or maintenance. So prevention and management. So smoking cessation, which is probably the hardest for those who do smoke, and is the reason that they have COPD. So all individuals who smoke should be strongly encouraged and supported to quit. Nicotine replacement and pharmacotherapy reliably increase long-term smoking abstinence rates. There's no evidence to support effectiveness and safety of e-cigarettes as a smoking cessation at present. Legislative smoking bans and counseling delivered by healthcare professionals improve quit rates. Quitting smoking and finding replacement therapy can reduce the symptoms of COPD and the frequency and severity of exacerbations while also improving health status and exercise tolerance. So these are just a few things. We had talked about this earlier in the last semester about ways to quit. That was part of our project as a group for the class. So you can do nicotine patches, lozenges, nicotine gum. They also have nicotine inhalers. You can also take medication to quit. And then there's also a bunch of benefits right here to quit smoking. Like after 20 minutes, your pulse returns to its baseline. After 3 days, you begin to breathe better and deeper. After 3 to 9 months, your lung function improves by as much as 10%. After a year, your heart attack risk reduces. After 10 years, your lung cancer is cut in half of that of a smoker. And then 15 years, your heart attack risk is the same as a non-smoker. So stopping is a very big deal in COPDers. So pharmacological treatment should be individualized and guided by severity and symptoms, risks of exacerbation, side effects, comorbidities, drug availability, and cost, while also tailoring to the patient's preferences and or needs. So if you're going to be giving these people with COPD, medications to stop smoking, we need to do it based on the severity of their disease, and it needs to be tailored to them. Prevention and management. So vaccinations, it is very recommended that if you have COPD, you get your vaccinations regularly. COVID-19 vaccines are highly effective against SARS-CoV-2 infection and is recommended for those with COPD per national recommendations. Flu vaccinations and pneumococcal vaccinations can help those with COPD reduce the risk of lower respiratory tract and also reduce the risk of lower tract respiratory infections. The CDC recommends the Tdap for COPD patients who are not vaccinated in adolescents. A routine use of shingles vaccine in all COPD patients is recommended. The RSV vaccine is recommended for those over 60 years of age or with chronic heart or lung disease as well. So basically, if you have COPD, these vaccinations are to help aid in you having a lower chance of exacerbation. Prevention and management. So active and healthy lifestyles plus pulmonary rehab is what we're going to be talking about. Pulmonary rehab has key components that help those with COPD, such as exercise training combined with disease education. This helps improve exercise capacity, symptoms, and quality of life across all grades of COPD severity. Since a significant portion, which would be 25 to 40% of those with COPD, may be depressed and can contribute to failed attempts to stop smoking, as well as their goals to overall improve their circumstances, it is very important to incorporate pulmonary rehab along with daily exercise and a healthier diet into their weekly routine. Physical activity is a strong predictor of mortality. Not only can these proactive health changes help reduce COPD symptoms, they can also reduce the anxiety and depression that may come along with COPD, eventually forming good long-term and healthy habits, improving the individual's quality of life overall. Other preventions and managements to consider. So a healthier diet and nutritious diet can help you feel better, fight infections, and maintain a healthy weight. Inhaler techniques should always be assessed regularly to make sure they are getting the proper medication down to where it needs to go. In patients with severe resting chronic hypoxia, long-term O2 therapy improves survival. Long-term non-invasive ventilation may decrease mortality and prevent hospitalization in those with severe chronic hypercapnia and history of hospitalization for acute respiratory failure. Stable COPD patients with resting or exercise-induced moderate desaturation, long-term O2 treatment should not be prescribed routinely. Individual patient factors should be considered when evaluating the need for supplemental oxygen, just like every other patient. Whenever you're prescribing medicine, oxygen is also technically a drug. This should be tailored to the patient and how their body is reacting and what kind of risk factors that this individual has. It is patient by patient. Things are done on a per patient basis. So it depends on the patient of what they are going to get. So in select patients with advanced emphysema refractory to optimized medical care, surgical or bronchoscopic interventional treatments may be beneficial. So these were preventions and management options. So here we have a flow chart of how we would treat COPD. So from the diagnosis down to just adjusting or tweaking their treatment plan. So diagnosis, you diagnose them based on their symptoms, risk factors, and spirometry. The initial assessment would be getting an FEV1, getting their symptoms from the CAT or MMRC, their exacerbation history, smoking status, their blood eosinophil count, A1 antitrypsin, see if they have that deficiency or any other comorbidities that they may have. The initial management, so you would recommend smoking cessation, they get their vaccines, encourage an active lifestyle, maybe even prescribe medications to help them stop smoking. Self-management education, inhaler techniques, ask them how their breathlessness is. If it's not too bad or super bad, have a written action plan or manage their comorbidities that they may have along with COPD. After this, you're going to review. So you're going to see what symptoms they have, their exacerbations, smoking status, exposure, risk factors, their inhaler techniques and adherence, physical activity and exercise, need for pulmonary rehab, self-management skills, need for O2, non-invasive, lung volume reduction or palliative approaches, vaccination, management of comorbidities, and spirometry. And then after that, we're going over to adjust. So you can adjust if they need to change their treatment plan, like the pharmacotherapy or non-pharmacological treatments. And that is their flow chart. But overall, the goals for treating COPD is to reduce symptoms. So you would want to relieve their symptoms, improve exercise, which will help improve their life or their health status. And then you also want to reduce risk. So you want to prevent disease progression, prevent and treat exacerbations, and then reduce mortality, which overall equals a good or better life for the patient. So that is all we have today for prevention and maintenance. And thank you for watching.